Hello, INBDE students. This is Dr. Babers, and I'm sorry for being away for a while because I was busy with the orofacial pain and oral medicine at USC. And now I'm excited to present cases for you with important points to memorize, helping you preparing for the exam. Also, at the end of this presentation, we're going to practice some questions to build confidence. Here we have a hypertensive patient who was diagnosed with amlodipine induced gingival enlargement. Our 47 years old male on amlodipine for hypertension developed gingival overgrowth, and based on the medical history, the diagnosis is amlodipine induced gingival enlargement. And the treatment is to ask patient doctor to change the medication. We do the oral hygiene routine and gingivectomy. Gingivectomy requires sufficient attached gingiva, and it's contraindicated if the pocket base is below the mucogingival junction. Usually, the laser option offers a precision cut and less post-operative discomfort. Amlodipine is a calcium channel blocker used to treat hypertension, and gingival enlargement is a side effect, one of the side effects, and management includes switching medication, oral hygiene, and gingivectomy. Amlodipine reduces the blood pressure by vasodilation, as we mentioned, with the poor oral hygiene, gingival overgrowth can be a side effect. The clinical presentation of this condition is having firm, symmetric, painless overgrowth in the gingiva and the anterior region. The treatment, let's confirm, is drug switch, scaling, chlorhexidine, and gingivectomy. For gingival overgrowth differential diagnosis, it can be for many reasons, according to the clinical exam and diagnostic tests and medical history. And it can be, this is a reference for you. I'm going to read the titles. It can be inflammatory due to bacterial plaque. It can be drug induced, which is the important point we need to memorize: anticonvulsants, immunosuppressants, calcium channel blockers, not beta blockers, calcium channel blockers. It can be hormonal, neoplastic, genetic, systemic, idiopathic, also vitamin C deficiency, and it can be also false due to bony swelling, not gingival swelling. From a microbiology perspective, black bacteria is the main irritant in the gingival inflammation of the drug-induced gingival overgrowth. That's why we do the oral hygiene routine and the gingivectomy. IgA protects our oral mucosa. IgG increases with the inflammation. And we finished the slides, and we're going to practice questions. Here I'm going to read the questions and give you some time to read the options. Which drug class is not commonly associated with the gingival overgrowth? Let's move to the next. Which of the following drug combinations are most likely associated with gingival enlargement? Great. Let's move to the next. Next, which of the following should be considered in the differential diagnosis of gingival enlargement? Okay. Our last questions. What's the main mechanism of action of calcium channel blocker in blood vessels? And thank you for watching the video, and see you in the next presentation.